The Lyme trials did not reflect my patient. I like to talk about this issue as part of my Common Sense Lyme Disease series. I'm Dr. Cameron. These are questions I often run into in my practice. The assumption is that if a clinical trial fails, treatment fails, and therefore one shouldn't proceed. This is what the goal is of evidence-based medicine. But what if the trial missed the mark? I had a patient that had early stage Lyme disease, was treated within 30 days, had hoped that they would remain well, but they ended up with a chronic illness. We do know that 1 out of 3 patients in some of the earlier trials were found to be sick on long-term follow-up. We had to treat, and the patient got better with retreatment. In this case, they just happened to have Babesia, which is a co-infection, and they got their life back. The trials were designed, the Columbia trial, for example, was enrolling people who were ill for an average of 9 years, who had failed 2 previous treatments. The Klempner NIH-sponsored trial, their patients had been sick for an average of 4.7 years, had failed an average of 2 treatments. None of the NIH trials included addressing co-infections or managing the cases on a one-by-one basis. They weren't designed to show us some of the recoveries like pain. What was missing is that the persistent infection hypothesis, the longer treatment options hadn't been addressed in his trials. They didn't address individualized care or any of the real-life variables about who they're treating, how long they've been sick, have they ever any other comorbidity. So what I saw for this patient is I individualized treatment, and the brain fog lifted. He was able to return to work. He reconnected with life. So the NIH trials in this case did not apply to him. The final message is that a failed Lyme disease trial doesn't mean my patient's going to fail. The study just didn't reflect him, and he got better. So this is something I run into all the time. There happens to be additional information from the Columbia trial that they were not able to have long-lasting improvement in cognitive function, but certainly improved fatigue. And there was a STOP study by Krupp and colleagues where there was a significant improvement in fatigue. So I'm left with clinical judgment. I wish I had NIH trials that reflect what I do in practice and what I do to get my patients better. So thank you for joining me for this Common Sense Lyme series, and have a good day.